everyone, I am Donami Boronta Chaman with Angeline Sultan. So today we will be presenting about Lydia Hall's care, core, and cure theory. Objectives. At the end of this presentation, audience will able to look into background of Lydia E. Hall, know Hall's theory assertions, discuss theory overview, understand 3 C's, which is core, care, and cure, define Hall's nursing paradigms, major assumptions, discuss strengths and weaknesses, application of Hall's theory.
So let's talk about who is Lydia Hall. Born on September 21, 1906, to earn a diploma in the nursing in the 1932 on the York Hospital School of Nursing, obtained Bachelor of the Science and the Master of the Arts degree at the Teachers College, Columbia University. Development, the care and cure theory has philosophy in the nursing. If a learning is the chef process he uses, then the chef's therapy his need is the teachings. House 1969.
So, Lydia Hall was a nurse who believed that patients get better results when they receive direct care from professional nurses, not just from practical nurses or a whole team where tasks are divided. She thought that the nurse's personal touch and professional skill are very important in helping patients heal. So, she did not agree with the idea of team nursing where different people handle different parts of patient care. Instead, she believed that the registered nurse should stay involved with the patient all throughout the healing process, even after the patient start to get better. So, now her theory is known as the care, core, and cure model. So, mamaya madidiscuss natin kung ano ang kanyang kung ano ang meaning ng care, core, and cure.
Let's proceed. Core model explanation. Sabi dito, noong 1962, Lydia Eloise Hall started the Lydia Center, kung saan ang mga nurse lang ang talaga ang gumagawa ng patient's care. Walang ideas or the helpers or licensed nurses lang yung mga doktor. Support lang sila sa mga nurse ng Lydia Center na may role pa siya na kapag sinusubukan ng mga messenger attendants na palitan ang trabaho ng nurse, matatanggal sila. Para kay Hall, gusto niyang ipakita na ang mga registered nurses, RNS, ang may pinaka-importanting role sa pagpapagaling ng pasyente. Pero ngayon, bihira lang to. Ganitong system ng hospitals, isa lang ang kilala na bumalik sa ganitong style. Ang Hahnemann Hospital noong 2012 kung saan ibalik all RN care ulit. So first, theory overview explanations. Lydia Eloise Hall theory has made in the late 1960s. She said that nursing has their connected the part, cure para sa sakit, care, pag-alaga sa katawan, and the core, yung mismong pasyente. For her, ang tunay na nursing ay yung ginagawa ng trained nurses na marunong at may malasakit. The main goal is to help patients stay healthy and live a good life. From the birth until all the age. She also said that nursing is a continuous process of the learning and the teaching between the nurse and the patients.
The core is the patient receiving nursing care. The core has goals set by him or herself rather than by any other persons and behaves according to their feelings and values. So the focus is on the person as a whole, not just their illness. The patient sets their own goals and make choices based on their feelings, values, and what's important to them. So basically, the nurse's role here is to help the patient understand themselves, support them emotionally, and encourage them to take part in their own healing process. So, for example, if a patient wants to get stronger after surgery, the nurse helps motivate and guide them, but the goals come from the patient themselves. Second, the cure. The cure is the attention given to patients by medical professionals. Hall explains in the model that the nurse shares the cure circle with other health professionals, such as physicians or physical therapists. These are the interventions or actions geared toward treating the patient for whatever illness or disease they are suffering from. So, the cure part is all about medical treatment. This is where doctors, nurses, and other health professionals work together to help treat the illness or disease. The nurse shares this rule with others, like giving medicine, doing wound care, or following a treatment plan. For example, a nurse helps a doctor by giving medications, monitoring vital signs, or assisting with physical therapy, all to help the patient recover physically. So the last is the care. The care circle addresses the role of nurses and is focused on performing the task of nurturing patients. This means the motherly care provided by nurses, which may include comfort, measures, patient instruction, and helping the patient meet his or her needs when help is needed. So the care part focuses on the nurturing side of nursing. This is where the nurse shows compassion, comfort, and support. It's sometimes called the motherly care part because it includes things like helping the patient with daily needs, giving comfort, teaching, or just being there for them. This is the part that really highlights the heart of nursing. For example, a nurse comforting a patient who's in pain or helping them eat or bath is knowing the care part of the theory. So, Lydia Hall focuses on people who are usually 16 years old and above, especially those dealing with long-term illnesses. She believes every individual is unique and has the ability to grow and learn. As a nurse, we should look at the person as a whole, not just their illness, but their emotions, thoughts, and life as a whole person. For Lydia Hall, health means being aware of yourself and being able to choose your behaviors consciously. It's not just about not being sick, but about understanding yourself, why you act or feel in a certain way. As a nurse, it's important to help patients explore the meaning of their actions or feelings so they can understand themselves better, solve their problems, and grow as a person. So, nursing, according to Hall, has three parts: the care, core, and cure theory. But for her, care is the main focus of nurses. It's our unique role to give care and build a strong, trusting relationship with the patient. The purpose of this caring relationship is to truly connect with the person, understand their needs, and help them through their healing process. So, according to Lydia Hall, the motivation and energy needed for healing actually came from the patient themselves, not from the healthcare team. Ibig sabihin, kahit gaano kagaling ang doktor or nurses, kung yung patient mismo ay walang willingness or motivation to get better, mahihirapan din siya mag-heal. So, the nurse's role is to help the patient bring out that inner strength and motivation para gumaling. Next, she said that three parts of nursing, the care, core, and cure are not separate. Hindi sila dapat tinitignan na parang kanya-kanyang function lang. Instead, they are interrelated, meaning they work together to help the patient recover. For example, kapag inaalagaan mo ang body ng patient, care, nakaka-apekto din ito sa feelings or mindset niya, which is yung core, at pati na rin sa treatment ng sakit, cure. So, everything is connected. And lastly, Lydia Hall said that these three aspects keep changing depending on the patient's situation or progress. Parang may three circles na nagbabago-bago ng size, minsan mas focus sa care, minsan sa cure, or minsan sa core, depende kung ano ang kailangan ng patient sa stage recovery niya. So, Lydia Hall is known for using the terms care, core, and cure, and these words are unique to her theory. So, siya lang ang gumagamit ng mga terms na yan in that specific way to explain what nursing really is. And second, Hall's work is described as completely and simply logical. Ibig sabihin, madali lang siya maintindihan at may sense talaga.
So let's proceed to the weaknesses. First is acute stage, the patients are not included. Hindi kasama ang mga pasyenteng nasa matindi o critical na yugto ng karamdaman. Ibig sabihin, mas angkop ang teorya sa mga pasyenteng nasa rehabilitations or recovery phase, hindi sa emergency or critical stage. Second, only applicable to the adult patients para lamang sa matatandang pasyenteng hindi ito agma sa batang sago o pediatric patients. Third, only tool of the critical communications is. So let's proceed to the applications. First, pediatric nursing, pangalagaan sa matatanda. Second, operating room or the nursing nurse sa silid ng operations. Third, critical care unit, the ICU nursing nurse sa malbaling kalagayan. Fourth, dialysis nurse, nurse ng pasyenteng nilasis.
So, in conclusion, Lydia Hall's care, core, and cure theory help us understand the different parts of nursing. The care part focuses on giving comfort and attention to the patient. The core part is about understanding the person's feelings and helping them grow. And the last is the cure part, deals with the medical treatment and working with doctors to help the patient get better. This theory reminds us that nursing is not just about medicine. It's also about caring for the whole person, body, mind, and heart. That ends our report about Lydia Hall's care, core, and cure theory. We hope you learned something new about how nurses care not just for the body, but also for the mind and spirit of every patient. Thank you for listening, and we hope you enjoyed our presentation.